morning. I'm Dr. Stacie Grossfeld. I'm an orthopedic surgeon in Louisville, Kentucky. I'm going to talk to you a little bit this morning about PRP preparation. PRP stands for Platelet Rich Plasma, and we do that in my office. And what we recommend is the night before you're going to have your PRP injection that you drink lots of water, hydrate, because we are going to be drawing some blood from your arm, potentially from your foot, depending on how good your veins are. So we'd like you to have a vein that is not dehydrated. So drinking lots of water will make the drawing of the blood process so much easier. Number two, we will be drawing about 10 to 20 cc's of blood from either your leg or your arm, and we will be centrifuging that and turning that into the PRP. So depending on how many areas we are actually going to inject that day will depend on if we're drawing 10 or 20 cc's of blood. Number three, once we draw the blood, we will put it into a special container that looks like this, and we will then insert it into a centrifuge, which will spin this container that has your blood in it, and it will separate the platelets from the rest of your blood cells. So we usually spin this about 4,000 times a minute for about 17 minutes, and that will produce about 3 cc's of PRP, which will then be injected into the joint that's affected. So number four, after the blood is separated, you'll have a high concentration of PRP, which is primarily platelets, and it will be a golden color fluid that we're going to be injected back into your injured area. The platelets are injected depending if it's for knee arthritis into your knee, if it's for shoulder problems into your shoulder, commonly for tennis elbow or Achilles tendonitis or even plantar fasciitis. PRP injections work great to get rid of the injury. After the injection, I've been asked very often, can I take an anti-inflammatory medication? You can take a COX-2, which would be most commonly meloxicam, which is a generic anti-inflammatory medication, or even Celebrex is a COX-2. But no ibuprofen, no Aleve for at least 3 to 4 weeks after your PRP injection. Some people will experience pain relief, especially if it's for a tendonitis, within 3 to 4 days. If it's more of an arthritis, it might take up to 6 weeks before you start to notice a significant pain reduction. Thank you.